Thank you. My 20 minutes has started, so I'm going to start. Thank you for staying in, and thank you for Jessie for leading in for mentioning data, because what I'm presenting on is a research project that I did that was part of a course that was offered for the first time in Australia last year through the Yale Let's Lead Lived Experience Transformation, long title, Leadership Academy. And that was a fantastic experience. When it comes up again, please apply, because it was really good. And so it involved 11 weeks of online education work, and then for the rest of the year, we worked on a project. And what I'm presenting on today is my project, which is a national review of people's experiences and values around supervision. And in the end, what I ended up doing it on was the perspective of the consumer peer workers, supervisors and managers. And I'm just going to go through all this raw data stuff really quick. I'm not going to even mention most of it. So just to say that, I was disappointed in the numbers. I was really hoping we'd get more peer workers. But, there was 100 peer workers. It is what it is. 30 supervisors and 28 managers. So each survey was a little bit different, but there were components that were the same. So, yes? The supervisors were people who were providing supervision, so not management supervision, but supervision. Professional development supervision. Yep. And within that group, I also broke it down into where people came from, so public sector, NGO, independent, private. The others were sometimes they mentioned charities. So just some of the information, the best information's yet to come. So, I did invite everybody, even those not participating in supervision, to fill in the survey, because it was their feedback. The feedback I got was so rich. So there were some people that did not receive any supervision, people that received monthly and individual and group. The supervisors, some of the important data was that 59% were people living with their own mental health issues or addiction issues. It was really surprising that there was, well, not really surprising, but there was no training and no consistent model across Australia. And there was really, 64% said there were no statewide or organisational policies or procedures that governs supervision. So those of us working in the sector will understand that this is not new knowledge. Only 38% were being paid, so that was a worry, which is part of this non-consistent model. With the managers, 43% were people living with their own mental health and drug and alcohol issues, which was fantastic that we actually had peer workers in those management roles. And some did identify as a peer worker, but it was interesting that some didn't. They didn't want to be identified as peer workers. And so 19% of those that filled in the survey identified benefits for the organisation as well as for the supervisees, and also the benefits for the peer workers. Sorry. So the top 10 values, which was really good, was the same across the three groups. So those were things like trust, hope, mutuality, establishing relationships, and environment, promoting trust. So like you wouldn't have a supervision session next door to your manager's office. Privacy and safety, payment for supervisors, challenging thinking, self-care, opportunity to debrief and problem solve, and personal decision making and evaluation was also, which I love, was seen as important. So some of the benefits for the peer workers were, the biggest one was discussing problems. So and sharing strategies with colleagues. I attend monthly group supervision in my LHD, and these are very much things that I identify that are really good about our supervision. We discuss discussing systemic issues, and also people were saying that it helped to understand and reduce compassion fatigue, which is, a big issue for a lot of us. And also understanding the mental health system was, of course, a big one. So things that people said that were not working well in supervision were things like lack of access. There were people that were saying they just don't have access to peer supervision, whether individual or group. The lack of clarity about the role. There were people that were not sure what it was all about and what was meant to be discussed, not meant to be discussed. Lack of choice, lack of time, and this really needs to be built into our work time. It's not something that should be voluntary. Also, the organisations and the services needing to be committed to it and to fund it, and also the commitment from peer workers, because if we don't participate in it and make it real, then it's not going to build. There were some of the issues that came up were boundary violations. So and this is the language from the people that wrote this. So they would where the supervisor was also the manager, and they would discuss operational issues in what was supervision, which is just not appropriate. So that's the conflict of internally providing that supervision was a big problem. So the personal agenda of supervisors, where peer workers said that they didn't feel safe. I remember one supervisor saying to me years ago that he was using his supervision to get data for his university work, and I just thought, no, that's not right. But so yeah, no, it's needs to be very much what the group is needing. So some of the important messages going forward is that all of these support mechanisms were said to be very valuable. So being here today, which is the state-based forums, having communities of practice. I understand that there's a leadership communities of practice happening, but it's something that could be done more widely within the workforce. We could base them on different services, different topics, different issues. So there's a lot more we could be doing. That intervision and that co-reflection with your colleagues is such a simple thing. I see Tamara here. Tamara pops into my office every Wednesday, and we just have a catch up, and it's so beautiful. I love it. I'd really miss it if she wasn't there. So don't go anywhere, Tamara. Only joking. So yeah, that sort of informal catch up is something that the peer workforce said was very important to them. So the other things that were important around access and choice, having training and payment for supervisors, having like models like. There was one question around, is there only one model? And of course that's not true. There are various models, but it's about having choice to who is going to provide supervision So also we need to educate our managers and the executives and that around supervision. So we need national and or state frameworks for training and payment procedures. The NGO and community sector, some of the things that they wrote was building it into tenders, and that is so important. I'm on a board for an NGO, and I have been saying that every time it comes up, build it into the tender, because that's the way we need to educate the ministry that this is an important part of peer workforce. Also, we need a national and or state database of peer supervisors and having maybe some sort of registration for that peer workforce, and it could be national because we can do so much online these days. Our group Supervision in Northern Sydney is online every month, but I think we hopefully might be going back to face soon. And of course having a national evaluation strategy so that we've got the evidence to say this is really helping our peer workforce. Because, over the years I've seen so many people leave their roles, and I had individual peer supervision from week one, and I often think about that person and how she helped me to survive some of those pitfalls and really difficult times in the workplace, and how much I've learnt from her. And so this is how am I going for time? So I'm all good, good. So the other thing is about having group and or individual supervision monthly with, high satisfaction of the services received. That was a strong message that people that were receiving supervision from an external peer was that it was very valuable, and it was they felt more safe. So people who were having supervision provided by an external peer said that was more safe. They felt more supported within their lived experience, and they also felt that the reduction of burnout and peer drift. So peer drift is like when we start to talk like clinicians. One of the roles I've had in my many years around is assessing mental health services with the Australian Council on Healthcare Standards, and I've heard numerous times where people will start to talk about, the people I case manage, and we don't case manage anybody. So, it's really important that we maintain our peer work values. And of course, just again to reinforce those important values of choice, hope, reciprocity, mutuality, safety and self-care. Our own self-care is paramount, and I'm probably not sounding very clear because my head's really buzzing, so I apologise for if I've made it a bit confusing. But if people are wanting to see the, please let me know, and I'm happy to email it out. It should be on the National Mental Health Consumer and Carer Forum site, and also the Mental Health Lived Experience Network site. But I'm happy to send it out if people want to read through the data and the people's comments, because it was wonderful to hear what people are thinking and saying about supervision. And, if there are people in the room that filled in the survey, thank you. and yeah, just when you see things like this, have a look at them and see how you can participate in it, because it's really important information and data that we need to get these things happening at a national and state level. So any questions? Oh, thank you. Thank you. Thank you. So is that right? Oh, yeah. No, I think I've been around long enough that nothing surprised me. I guess I was disappointed in the number of managers who thought it was okay to provide supervision internally. And that really disturbed me. I thought that's not good. We need to have some way of letting people know that that's not what we consider as peer work values. And yeah.
Hi, Paula.
Ooh.
Hello, it's me, Jemima.
That is.
Hi.
Oh, where's it coming from?
Over here. Hi, hello.
Phew. It's not in my head.
No. This is a voice of Jemima.
Jemima.
Could you talk more to the point on personal agenda of supervisors coming through?
Yeah.
Because it's an interesting point, and I'm wondering,
I'll just see if I can
if there was
find
any
the
more
comment.
information around that.
Yeah. Okay. Here we go. I bought the report with me just in case I had questions like this. So where is it? Choice. I think it was, the one example that I gave before was the guy who was using the supervision to gather data for his own university course, which, is not appropriate. But I guess it's if the supervisor comes into the session with a personal agenda about how they think it should go, supervision is very much around what the peer worker needs, whether it's to talk about, conflict or the system or how to do a particular part of our role, those sort of things. But so like with our supervisor, she has ideas, she has topics written down that we've mentioned over the months, but she's not pushing her agenda on what we're going to talk about. We don't talk about operational issues. Oh, hello to the people online. Sorry, I just realised I should say hello to them. Told you my head's buzzing. So I don't know if that answered it enough. I'm happy to send out the full report. Oh, there we go. There's my music. Better go before I lose the microphone. Thank you, everyone.